Good day, I'm Theodore Orlando Duxbury, a PhD candidate in pharmacy practice, done in collaboration with the Rhodes University Community Engagement Department. Born of the Eastern Cape, the principles of Ubuntu fuel my vision to uphold essential human virtues. And it is throughout my whole postgraduate career that I devoted myself to community development. It is through this process that I came to recognize that as a healthcare professional, it's time to consider not only the aspects of medical care, as important as it might be, but to also consider its social determinants. And through focusing on health holistically within this way, I believe that a more productive society can be promoted. I became excited when approached by the Amakala Foundation to conduct a health development project. And I immediately said yes and started planning an exciting and impactful project entitled Building Health Resilience, an Engaged Systems Analysis and Epistemically Just Approach to Rural Health Development. Inadequate health coverage to rural areas, including rural game reserve villages such as these, result in reduced access to healthcare. And despite increases in healthcare facilities in remote rural areas, significant barriers to health development remain, such as affordability, mobility, travel costs, socio-demographic factors, and the quality of healthcare, amongst others. Health inequalities within South Africa remain robust despite the restorative efforts of the post-apartheid government, and it is usually marginalized families such as these that are often unable to obtain even the most basic forms of healthcare. I had so much fun meeting all the members of the Amakala communities, understanding their culture, exploring their assets through participatory concept mapping, focus group discussions, and semi-structured interviews. The aim of this project was to promote disease prevention and to develop health through focusing on what we have, what is good, and what is strong, instead of focusing on what is lacking. And it is through this asset-based approach that we came to realize and celebrate everything that the villages of Amakala have to offer, which they could use to promote health, specifically with hypertension and its risk factors, as well as COVID-19. It was so encouraging to see the community members come together every week to share, analyze, and enhance their health knowledge and practices, and to evaluate, plan, act, reflect accordingly. Health development projects such as these promote epistemic justice, which is to acknowledge, value, and involve prejudicially marginalized groups as knowers. And we made sure to honor the principle which states, don't plan about us without us. So thank you to the Amakala Foundation for supporting this project, and thank you to all the participants for taking ownership of this project and for the role that you have played in expanding knowledge boundaries. Thank you.